Assalamualaikum warahmatullahi wabarakatuh. Morning everyone. My name is Nurfaizah and I want to present about the material acting out. Please listen and pay attention. What is acting out? People say a child is acting out when they exhibit unrestrained and improper actions. The behavior is usually caused by suppressed or denied feelings or emotions. Acting out reduces stress. It's often a child's attempt to show otherwise hidden emotion. Acting out may include fighting, throwing fits, or stealing. In severe cases, acting out is associated with antisocial behavior and other personality disorders in teenagers and younger children. Next, what causes acting out? The psychological factors that prompt acting out are often complicated. Common issues that cause a child to act out include: first, attention issues. Children often seek attention from parents, peers, or other authority figures. If they don't get the positive attention they want, they will act out to get negative attention. Next, desire for power. Children often feel powerless. They are usually unable to control their situation and environment. They act out because it allows them to feel in control of their actions. And next, self-esteem issues. Children who believe they are unable to perform a task may act out to distract a parent. Next, personality disorders. Personality disorders that lead to acting out are more common in adults and older teenagers. They include antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorders. In children, attention deficit hyperactive disorder or ADHD may be associated with acting out. Next slide. How is acting out treated? Your child will rarely need medications to address acting out. Medications may cause your child to be more sedated and less prone to outbursts. They do not address the underlying cause of the behavior. In most cases, your best chance at adjusting your child's improper behavior is to encourage better behavior. Here are some guidelines for responding when your child acts out. First, maintain clear expectation. Set clear and detailed expectation for your child. Be consistent with your rules and the consequence for breaking those rules. If you remain firm and organized with what you expect from your children, they will be less likely to act out. Next, keep it positive. A positive parenting approach focuses on rewarding children when they are being good. Rewards can be as simple as paying your child extra attention, praise, or even a small token. This will reinforce the child's acceptable behavior. You should avoid giving your attention to a child acting out. This will only teach the child if they want your attention. They just need to misbehave. Next, stay cool. Taking the time to acknowledge and reduce your own stress signals will help you cope with a challenging child. If you are calm even when your child is acting out, you will be in a better position to react properly to their behavior. And next, don't take it personally. Your child's actions most of the time your child's actions are not a direct attack against you. Your child is just using this behavior sometimes subconsciously to deal with a sensitive issue. If you are emotionally hurt by your child's actions, you may be too upset to discover the real reason behind your child's behavior. And next slide, understanding the 7 phases of the acting out cycle. In this short piece, we discuss the 7 phases of the acting out cycle and what teacher needs to know to provide timely interventions. First, calm phase. The first phase of the acting out behavior cycle, during which students' behavior is characterized as goal-directed, compliant, cooperative, and academically engaged. Students are responsive to teacher praise and are willing to work with peers. Next, trigger space. The second part of the acting out behavior cycle, students' misbehavior can be triggered by an issue that is left to fester. Next, agitation phase. The third part of the acting out behavior cycle, during which students manifest a variety of sometimes contradictory seeming behaviors. Next, acceleration phase. The fourth stage of the acting out behavior cycle, during which a student exhibits an increase in the frequency of problem behavior. However, the acceleration phase falls in the middle of the acting out behavior cycle. And next, peak phase. Stage in the acting out behavior cycle, during which a student's behavior is clearly out of the control. Students may physically assault others, hurt themselves, cry hysterically, and destroy property, any of which may produce devastating outcomes. And next, the escalation phase. The sixth part of the acting out behavior cycle, in which a student exits the peak phase confused, disoriented, and at a reduced level of agitation. Withdrawal. Many students will responsibility, blame others, or attempt to reconcile with those they harm or offended. Even though students will probably not want to discuss the incidents, they are often responsive to directions. Last, recovery phase, the seventh and final phase of the acting out behavior cycle during which students are generally subdued and may still want to avoid talking about the big incident. Teachers often incorrectly think that they will retrieve the misbehavior if they try to debrief the students. And thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.